And after the robot's done with this part, then the human comes back in and puts the implant into that hole in the skull and then covers it up, screwing it down to the skull and sewing the skin back together. So the whole thing takes a few hours. During the procedure, surgeons make a cut in the skin on the top of the head over the area of the brain that's the most potent representation of hand intentions, according to McDougall. If you are an expert concert pianist, this part of your brain's lighten up the entire time you're playing, he said. We call it a hand knob. Even quadriplegic patients whose brains aren't connected to their finger movements anymore still imagine finger movements, and this knob part of the brain still lights up, the neurosurgeon said. Neuralink's upcoming implant plans. Despite those issues, the company says it has more than 1,000 volunteers ready for upcoming surgical trials. Musk says he hopes to reach his goal of implanting his chip into 8 more patients by the end of the year, but that's still subject to regulatory approval. It's hard to believe, but Neuralink's accelerating its efforts to maximize efficiency and restore function to thousands of patients.